Hi, my name's Hannah, and I'm a medical assistant here at Dr. Joel Foster's office. I'm here today with Dr. Foster, and we're going to be talking about neuropathy, what it is, and treatments that we have to offer for it. So, Dr. Foster, what is neuropathy and neuropathic sensations?
Well, Hannah, neuropathy really is a vague term, but it just means that the nerves are not functioning well, and that can lead to various sensations. Some people have burning, some people just have numbness, some people have tingling, some people lose balance, some people have severe pain that they can hardly function and definitely can't sleep at night.
Yeah, I've heard a lot of our patients come in and tell us they experience those sensations, but what is it that actually causes that numbness and tingling and neuropathy?
Well, it's caused by the nerves are typically entrapped. Usually they will get entrapped, impinged under different ligaments, tendons, muscles. That happens. A lot of times also it can be caused by diabetes. So when your blood sugar is out of control and that gets elevated, the sugar actually gets into the nerve tissue and then the nerve cannot function well. And also it causes the nerve to swell, which also causes more of those compression type symptoms.
A lot of patients have told me they take either gabapentin, different medicines, and other treatments that they've tried to take to reduce those sensations. Do you feel like those traditional treatments are helpful?
They can be helpful, and that's why they've been used for a while. They can be helpful in reducing some of those symptoms. They certainly aren't going to fix anything. They're not going to fix the problem, but they certainly can have some benefits. The hard part or the negative is that they do have a lot of side effects. Most people get drowsiness and they feel lethargic from some of those kind of medications, and a lot of times they don't work as well after a while, so they continue to increase the dosage and then they get more and more side effects from them. Other traditional treatments can include surgery. So there are surgical nerve decompressions that can be done that actually are very successful procedures, but they have their side effects and negativities as well. So if you have a surgery, you could potentially have a wound that doesn't heal, or you could have scar tissue and sometimes more pain afterwards, and sometimes you'll get infections. So there are also some negatives to surgical interventions.
So, our office offers Neurogenics treatment. What is Neurogenics and how does it differ from those traditional treatments you were talking about?
Well, Neurogenics is different because, first of all, it's completely safe. There's no side effects, there's no negatives to it because there's no medication, so you don't have to worry about side effects of that. There's no surgery, so you don't have to worry about incision sites or postoperative pain or infection or anything like that. What it does, though, is it sends an electrical signal through the nerves, forcing the nerves to start functioning again. And that's how it works, and that's why it's different from traditional treatment. So it's very safe and very highly effective as well.
Would you say it cures neuropathy or what does it do to help with the neuropathy sensations?
Yeah, I wouldn't go as far as to say it cures neuropathy because it's traditionally not going to do that. What it will do is improve some symptoms significantly. It does make these symptoms significantly reduced. We have a lot of patients that, for example, couldn't sleep at night and now they can sleep better. Or they don't notice it at night anymore, or their symptoms are reduced by 50 to 75%. People that have balance issues or trouble driving, a lot of times now they can do those things because their symptoms are reduced significantly.
So, if a patient was going to proceed with Neurogenics treatment, what is that? What is it like?
So, what happens is they come into the office and we put some electrical leads on their legs and on their feet, and then we send that signal through those leads. It is a very unique treatment in the fact that it's different from a lot of other electrical stimulation treatments. Some people are familiar with like TINS units, and they'll ask, is it similar to that? And actually, it's significantly different because a TINS unit maybe goes to 1,000 hertz at most, where the Neurogenics treatment will range all the way from 400 hertz on the wavelength to 40,000. So it's got a very wide range. And then it actually has a signal that mimics the body's kind of natural varying electrical signal. So it works far better than any other treatment that's out there as far as electrical type stimulations, similar to TINS units and things like that.
And is this something they do just one time, or how often do you do the treatments?
Yeah, the treatments are done over a period of about 3 months. Typically, we recommend doing it twice a week over about a 3 month period. We do 24 actual visits, and during those visits, you get 2 treatments. Each treatment is 25 minutes, so it's about 50 minutes twice a week for about 3 months.
And have you ever tried this, or do you have any experience personally using this?
I do actually, and that was one of the things that got me interested in it right off the bat when I heard about it, because I actually have neuropathy myself that I got from chemotherapy. So I have firsthand experience with neuropathy and also with the treatment itself. So my experience after my neuropathy, or after and during my chemotherapy treatments, I had a lot of burning and tingling and numbness in my legs and feet. I was even getting kind of sharp pains that I would get just sitting at rest, and that's when it bothered me the most. After the treatments, the leg pain has gone away completely. The numbness and tingling has reduced significantly. Now, I still have numbness in the ball of my feet, but for the most part, it is significantly better than it was prior to the treatment. So it's been a real big help for me.
Well, thank you for answering those questions about neuropathy and neurogenics. If you have any other questions, feel free to call our office or visit our website for more information.